Good afternoon. Thank you for joining us today to talk about caregiving. I'm Linda Hashef, Community Outreach Director for AARP Nevada. We are joined today by longtime caregiver and our Executive Council member, Laura Koger. Laura, thanks for being with us.
I'm so happy to be here. You know, I'm passionate about this topic, so you might have to slow me down at points.
Well, we really want to hear what you have to say today, and today we're going to talk about caregiving. Around the family caregiver, the unpaid heroes that take care of their family and their friends and their neighbors. I know that you have been taking care of your family members a very long time, and I know that you will have a lot of information for us today, and that you especially have a lot of caregiving duties because of your older folks and your grandkids.
I am so lucky. I'm really fortunate that I've been able to help with care. I'm not a primary, 24/7 kind of caregiver like those heroes you mentioned a minute ago, but I've been part of care teams for years. First with my niece, later with my dad, and now with my mom. And I'm just so lucky to have had those experiences. I wouldn't trade them for anything. And I've been really fortunate that during my career, I was able to meet amazing caregivers all over the state of Nevada and really learn from them. It's just an amazing journey that everybody's on, and each situation is just a little bit different.
Sure, sure.
I know caregivers have a really hard time, a really challenging time prioritizing how to spend their time. Everything seems like it's really important, and you want to do the best possible job for everybody. And you might, forget to ask for help and accept it.
Right, very key and important tips right there. Ask for the help and be ready to accept it. So before retiring, you were a longtime professional in a self-directed in-home care company, correct?
Mm-hmm.
So you've seen both sides of caregiving.
Yes.
So give us, how helpful has it been being on both sides of it?
Oh my gosh, seeing that perspective from the provider's point of view, where they are trying to do the best they can to help a family, connect them to resources or do a service for them. And, they can't always meet everybody's needs exactly the way they want it. And from the caregiver side of the table, I know why that is. Families in that situation who need some help from outside the home are frustrated, they're scared, they've never done this kind of thing before. They just want everything to happen yesterday. I mean, they're in a need that is oftentimes in crisis, So it's been very helpful. My career, the company I worked for, fortunately had a focus and really embraced self-direction, which means basically that the person who's receiving the help is in control and they're managing their own care. And the focus was on person-centered planning, which is so important, really just makes the person who's receiving the care or that care partner at the heart of any planning and discussions around what services are needed and what the goals might be. So it's very helpful.
That's really interesting, Laura, because instead of it being someone who comes in, you walk in, I'm now the caregiver. It's actually a team approach between the person that's going to be cared for and the ones coming in to help them out. That's kind of what you learn through your professional career.
Absolutely. So often all the way across the state, there's a caregiver caring for one person. I call them care partners. Mm-hmm. The caregiver and the care partner. But anyway, in that partnership, the two of them can't handle everything alone. They do often need other resources, and they need to expand what I call a circle of support. In my work, I was really privileged to get to learn how to help people expand their circle of support, and around Nevada see how different people in different geographical areas, more rural, tend to be really interesting the way they accommodate not having a therapist nearby, not being able to get in-home care in many cases, and how do they manage and what are they doing? They're tapping into that community's resources, whatever they might be. And so I was fortunate to be able to help people with that.
Well, that's really great information, Laura. And you mentioned caregivers usually come about this role unexpectedly. You don't have a lot of time to plan, and so that adds a lot of stress to the already stressful situation. And so sometimes they're not sure where to turn. What would you say to new caregivers who feel alone or isolated?
oh my gosh, I wish I could give them a hug first, but
Yes.
I'm not able to do that. But I'm able to do something like this and help sort of share some information I've gathered over the years. And that is that basically take care of yourself first. Really, you can't take really exceptional care of anybody without taking care of yourself first. And, you know, I became a caregiver overnight too. I think a lot of people fall into caregiving. Someone has a car accident or a stroke, a heart attack, something like that.
Right.
And depending on your situation, if you're available in the family, you know, you'll step in. I mean, that's what's going to happen, but you don't necessarily have the skills to serve somebody, you know, to transfer, to learn how to do a shower for someone who can't sit up.
Right. Yeah.
And all those kinds of things. And I have a recommendation that they phone a friend, and I mean that not in the way that they're going to help make you $1 million like on that show,
Yeah.
but that they're just going to, you know, say, hey, tell me a joke, please. I'm ready. Somebody tell me a joke today. Or do you mind if I just vent for 15 minutes and then you don't have to solve my problem? Just listen to me for a little bit and let me cry on your shoulder.
Right.
Caregivers need that kind of thing, you know. They also need to think about respite, which just basically means giving the caregiver a break, finding a break for yourself. It doesn't necessarily mean that you go outside and hire an agency to send a caregiver in, which I recommend if you can afford it.
Mm-hmm.
Obviously, you want to make sure you are arranging time to be off duty. But that can be in little chunks. You know, someone who likes to cook, ask them if they wouldn't mind bringing dinner once a month or once a week if they like. That's something you could count on as an evening where you could go to bed early, you could go take a bath, read a book, that kind of thing. Research and reach out is another comment. I say that to caregivers all the time, whether they're new or whether they've been at it a long time and they have gotten back into that habit of not reaching out. Research, which means basically look around you, find out who else can join that circle of support, what resources might be in your community. AARP.org/caregiving, awesome one, and washocaregivers.org are both excellent places to turn for realizing you're not alone.
So, you know, those were really good tips. A couple things that I think I heard you say is you're not in it alone. You don't have to go it alone. Find ways to build your team of support around your caregiving duties.
Mm-hmm.
And it might be invite your friend over who makes that dinner. You know, have the phone calls that help you relieve your stress just a little bit. And I'm just curious, Laura, with your experience on the professional side and the personal side, how easy is it for caregivers to feel that it's okay to take a minute for themselves?
Oh, wow. It's a tough one. You know, when I first became a caregiver, my niece had a stroke and she was 20. And
Wow.
You know, our care team was put together overnight. I happened to be one that could be available to be with her during the day and her parents at night and on weekends, and we just sort of did what we could to sort of take turns. And a lot of the time in the beginning, you're winging it. You're kind of in a daze. Nobody's sure, you know, what should we really be doing?
Mm-hmm.
The plan comes about in a brand new situation like that. Gradually sometimes, but I had worked for Medicaid, so I kind of knew to research and find out what was potentially out there to help us. Found the in-home company that was self-directed care that helped us a lot, and to reach out. You know, my sister was able to connect with a therapy group that at the time would come to the home, and they had a team. So we really wanted to learn as much as we could because that boosts your confidence,
Sure.
makes you feel like you can do this. And also those folks help you realize that it's okay for you to take a break. Hey, you've been up all night. Go nap. I got this. Or you are trying to remind each other to do some self-care, basically. And that's just, you know, so important. You know, I know it's just another reminder. You're not alone in this. There's people out there that care.
And I'm sure it can feel very lonely.
Yes.
You know, it can feel very, so like the whole world's on your shoulders. And so if you just know that places like AARP and lots of other really good agencies in our community, they're there to help. And they have been at it a little bit, so they kind of can almost help you anticipate what might come your way. And we're going to talk a little bit about tools and resources, but you know, AARP has a Prepare to Care book
Right.
And I know that you actually do presentations around town based on how to use that book. Do you want to talk about that just a little bit?
Yeah, and that booklet for Prepare to Care is available at that same website, aarp.org/caregiving, and you can download it or have somebody mail it to you if you want. And that Prepare to Care is really interesting. They cover some really good, sort of start the conversation is one of them, like make sure you talk to the person who's your care partner, the person that you're helping. To make sure they're involved in the discussion. What are the goals? You do want to live at home? Are we getting you ready to move to an assisted living? Are we going to look down the road a little further? Maybe they just got the kind of diagnosis where a conversation around hospice should come up. And a lot of people might give you a lot of pushback. There's discussions in there around how to talk to somebody about driving, for instance. That could come up, and people don't want to have these uncomfortable conversations, but AARP, there's some really good information about how to start those conversations and how to make a plan, always involving the person who's receiving help at the heart of that plan. What should we do? And guess what should be in the plan? Having some fun. Everybody, caregivers forget about their own doctor appointments, dental appointments, self-care, but they also forget to plan for something fun, something that you enjoy doing and that the person that you're caring for may enjoy doing and has just not had a chance because everybody's worried about the next meal, the next shower, taking care of continence issues, whatever it might be. Those are kind of what takes over the day sometimes, or the week, or the month. And you can't let it get to that point. You got to put it on the calendar. Hey, we're having a picnic tomorrow, even if we have it right here at your bedside. That kind of thing.
Well, that is really good information, Laura, and I think just letting caregivers know it really is okay. Not only is it okay, it's imperative they take care of themselves.
Right. Absolutely.
I use the term you can't pour from an empty cup.
Right.
So, and a lot of our caregivers in the state of Nevada still work full-time jobs.
Absolutely. Oh, when I was working and helping to care for my dad, on the weekends I was traveling to go there to help my mom, who was 84, and trying to be his primary caregiver. Ooh. So we have a large family, 10th of 13 kids. Ooh, so we had a deep circle of support. We were very, kind of already set up with a team in a way. So it was a matter of organizing folks. Who can do what? Who can help with mom's finances, and who can help with helping get us connected, dad, to VA services, for instance. And how can we do, each person kind of brought something different to the table. Some of my brothers are that it's in my wheelhouse to do yard work and things that need repairing around the house. And sisters that are great at cooking, I'll come and prepare a whole week's worth of meals. So whoever's there, staying there with mom and dad, doesn't need to cook. So we were an exception to the rule for sure. Most people who are doing this full-time, who are trying to work and do caregiving, a lot of times they're either by themselves or they may have siblings who live far away who are able to come and give respite sometimes, but they haven't yet connected or widened that circle of support enough yet. So that's why it's extremely important.
Well, and I think being one of 13 siblings, first of all, is amazing. But then to bring all those skill sets together is even better. What I do think happens is, like you mentioned, the folks who may be one of two siblings, maybe they don't live in the same state. But that's why we are talking about the different resources and the tools that are available to everybody, whether you're one of 13 siblings that can come together as a group, or you're the lead caregiver and you still work full-time.
Right.
And that is a lot of people who work, or that exist in our state of Nevada, who are caregivers. So we've come together as AARP to do presentations and bring this information to the community. We bring the books that help you plan. Right.
There's this one, a caregiver resource guide, also available on the website, and also I think they'll mail it to you too if you ask for this one as well, along with the Prepare to Care. It has really good lists, like you can make a list of here's all the needs, and you'll go over that with the person, your care partner, the person that you're helping. What actually do you need help with, and so forth. And then there's also the WashoCaregivers.org has an excellent resource book as well, and that's local to Washoe County. It's designed, and I was because of AARP, I was the representative on the steering committee for this. It's called the Nevada Caregiver Support initiative. And it's basically designed to, what can we do to help Washoe caregivers? What can we do to better support them? So designing, we had some community meetings, and out of those meetings came, this is what we want most, an easy way to find resources. So the very first thing that we did as a group, and that's through the Community Foundation of Western Nevada, excellent group. And they, I was really happy that AARP asked me to do something I'm passionate about and help caregivers by helping to put together this book. And it's a resource guide that in it has all kinds of things, and it even has a page in there about what if you're working, you know, what are some of the things you can do? Talk to your boss, talk to your coworkers about, you know, try to get, and actually talk about widen your circle of support. Those are folks that need that more than anybody. Who can give you a Wednesday night off? You know, you're working all day and you're working with someone else at night. And so these folks are absolutely in need of some sort of respite care. And I understand you have some listed, but this one is really designed for brand new caregivers. So it gives you tips and help all the way along from other caregivers how to be a new caregiver. But on the website, there's 300 plus resources to basically help you get that circle of support expanded.
Well, that's really wonderful. So we've got one specific to Washoe County. We've got one that's statewide.
Right.
And I know we're on Facebook Live, so we're talking to everybody that is joining us from the entire state. So we will have stuff specific to Southern Nevada too.
Right.
So I feel like we've really done a lot of work together to figure out how to support our caregivers, gather the information for them into one spot in resource guides, in books that walk them through what we know are going to be at least some of the steps they're going to take,
right,
or some of the issues that are going to come their way. We talk to them about forming a team and
right,
how if you aren't one of 13 siblings, where to gather,
right, how to get that team,
how to get that team concept put together. And the other thing that as I go around, I get to participate in caregiving in the state too, is the one biggest reminder I think I will give to new caregivers is know your specific situation. Know what coverage your loved one has that you're caring for. Know what that means if you are going to have this treatment or that treatment. You know what it means if you've been in the hospital for 3 days and you get referred to a rehab facility. Know if you're covered, because you're the only one who's going to know that answer, and you don't want to end up on the other end with, you know, unforeseen bills or unforeseen issues that just by asking a lot of questions on the front end may prevent a lot of that.
Right. And the other huge one, ask for and accept help. It's so important to just get to that point. I think a lot of caregivers are like, I don't want somebody to see my messy dishes, my messy house. I don't want someone to think I'm not doing a good job or that I can't do it alone. You know, a lot of caregivers are multitasking, they're working, they're raising kids, they're sometimes raising grandkids. They're taking care of elderly parents and helping to raise their grandkids. It's a different you know, situation than they were in before. So it's always good to try to ask the people who have that expertise to get involved with you, and more information is only going to help.
That's a really good point. And I think people may be surprised to hear that at any one time in the state of Nevada, there may be over 500,000 people who identify as a family caregiver. That is a lot of people. So even though it might feel like you're in it alone sometimes, you're really not. There's so many people out there that are either going through it or have gone through it and who have offered up this, these words of wisdom that we've put into books for them. And also that, you know, if that unpaid family caregiver were to actually have to be paid for their services, that equates to like $4 billion. So this is no small topic or small change.
Not at all. And just on that topic, that the company that I worked for, or a company that is focused on self-direction, the person at the middle who gets to choose their own caregivers, schedule of their own caregivers, they can help with training that caregiver, that family caregiver who doesn't know where to start, what to do. But they can also, depending on the eligibility of the person, the care partner, if they're eligible for Medicaid in the state of Nevada, the family caregiver actually could receive some compensation. But like I always used to tell people, it's some help where there wasn't some before. You know, they might only be paid for 2 of the 24 hours that they're caring for someone, but it's some help where there was none before. So that's another thing to investigate if folks are in that situation.
That's a really good reminder. You know,
Right.
through certain programs through the state, maybe you are eligible as a family caregiver to receive some compensation.
If there's a caregiver who's caring for a veteran, for instance, the VA has a great deal for caregivers who are caring for someone who was injured in the line of service since 2011, 9/11. They are eligible for some additional training through the VA. The caregiver is eligible for some training and compensation. So, and the veteran themselves could be eligible for some aid in attendance, which is a stipend to help them pay for care. So a lot of folks don't know that they could potentially connect there as well. So it's something to look into.
That's a really good reminder, and I know there's something around Agent Orange that they have benefits. I only know that because I work in Veterans Outreach, and you are related to veterans and active duty military.
Yeah.
So that's a good reminder too. Some of these benefits can be layered. If you're a veteran, if you're in the VA system, you get VA benefits and you get other benefits too.
Well, and, you know, there could be layers for a caregiver no matter what. I mean, don't overlook those disease-specific resources, like if your parent or whoever you're caring for has Alzheimer's, for instance, the Alzheimer's Association can provide you with some excellent training and support, caregiver support groups. There's caregiver support groups for cancer from the Cancer Society. There's, or for stroke, you know, our hospitals here have a stroke patient support group and caregiver support groups and stuff. So it's just, you just got to get out there and look. And a lot of these are listed on the AARP.org/caregiving and washocaregivers.org.
That's other really good reminder. So two things I think that we can have people take away. Know your insurance coverage, your medical provisions for your loved one. And on the flip side, know what resources and tools and potential support systems there are for you as a caregiver. Illness specific. And one thing that came up while we were doing some caregiving work in the state is don't forget the support groups related to specific illnesses. You know, a lot of the people that come to those, they come together because they've experienced what you're going through or still experience it, and they're going to have a lot more tips than we do, very specific to what you're going through as a caregiver.
Exactly, and some of them even have vouchers for respite, and the Alzheimer's Association does have a voucher. They can give the family a voucher for I think it's up to $1,000 just to help the caregiver get a break. And there are others, the ALS and MS Society, and there's other ones that can help with giving the caregiver a break.
And a lot of times these respite services are free. Is that correct?
That's correct, yeah. The, oh boy, Senior Service Network, no.
We're going to put a list up.
There's a few. Yeah, we're going to put a list up on the Facebook page or on the AARP Nevada, and both. And so we'll be able to see those. But the respite services across Nevada, that and the ones you design for yourself, what works for you. You may not have talked to a neighbor in a long time. Now's the time. Right. You know, don't wait till it's raining. When you say, oh, on a rainy day, I'm going to talk to that neighbor. Do it now. Yeah. And just tell them what you're going through. And you know what you might hear back? Oh my gosh, I know what you're going through. I cared for my mom or my grandma or my nephew when he had his motorcycle accident. There's a prevalence of it. People don't necessarily want to talk about it, but as soon as you do, you're going to find someone who relates to what you're going through, and it's so important.
Definitely, and I think it will be pleasantly surprising how many resources and tools there are out there for such an maybe not the funnest position to be in. There's a lot of us out there working hard to make sure that the family caregivers are well taken care of, and that includes us fighting for state laws for caregivers.
Oh my gosh, advocacy. You know, we were able to pass the CARE Act unanimously in Nevada, which how often does that happen? Barry Gold will tell you, not often.
Right.
Do everybody, all the legislators agree that this is a great idea? The CARE Act, the AARP, passed 2 sessions ago, I think it was, and that's just to help when someone's getting discharged from the hospital for the caregiver they selected, and they told the hospital about, here's who I want to know when I'm getting discharged. That person will not only know, they'll get instructions about the discharge and make sure they have a safe way to take care of the person when they get home, rather than somebody go, oh, I'm getting out, tell me where to sign that. And those instructions about discharge disappear within a half an hour, I think.
Right, very good point.
So now you've at least got the caregiver hearing those instructions as well, and has paperwork to call for additional training if they need it, or to ask for clarification on when was I supposed to do those meds again, and so forth. If it's the person themselves signing their own discharge paper without that extra layer, it's much more problematic, and folks end up back in the hospital more often.
Exactly. So we talked about tools and resources and presentations we can do in the community, the laws we fight for. So if you're interested in joining our team even to fight for caregivers, we're always looking for people to do that. And if you have any questions or want any additional information, please feel free to leave a comment in the message portion of Facebook. So, Laura, do you have anything else you want to talk about?
I'm so thankful that you invited me to do this today. I'm passionate about caregivers and caregiving, and I hope that we were able to reach some folks who, if you're not a caregiver yourself and you heard this today or you watched this presentation today, I hope that you'll take it back to people who you know, or some neighbor over the fence tells you, guess what, I'm taking care of my mom. You'll go, oh,
exactly.
I heard something the other day. So, I'm hoping that the more we talk to people about caregiving and the struggles of isolation, and caregivers can be depressed and not want to admit that. They think someone's going to think, oh, if you're depressed, maybe you can't handle this. Yes, you can. You need a break here and there.
Right.
You got this, and you're all whoever's out there doing this. My hat's off to you.
Right. Well, and thank you, Laura, for being here, because I honestly don't think we could have had someone more perfect in this role for us. And thank you for being on our executive council team. So in closing, we want you to know that AARP is here for you. We have tools and resources. We want to hear from you. Call us, email us, send us messages in Facebook, and we will get back to you and get you as much information as we can. Thanks, Laura.
Linda.
Are we off? We're off. Felt like we were talking really fast, and I kept track of the time. I'm like, I don't want to end too soon.
We're good?